Well, we haven't hit full flu season yet, but already 4 times more cases have been diagnosed than at the same time last year. And the states of Queensland, New South Wales and South Australia are suffering the most. Robert Booy is the head of clinical research at the National Centre for Immunisation Research and Surveillance, and he's also Professor of Child Health at Westmead Children's Hospital in Sydney.
Well, I think last year was quite a mild one. This year is at least a moderate to severe year. And partly it's because people lose immunity, partly because there hasn't been as much immunisation this year, partly because all the rains have kept people inside and they spread the virus more readily.
So why are some states, Queensland, New South Wales and South Australia, particularly badly affected by flu?
In Queensland they've certainly had a lot of rain, as I've said already, but also they do a lot more testing in Queensland, so there's a lot more flu always out there than we actually know about, and Queensland's finding more of the real cases by testing more often.
And is there just one strain of flu around this year, and how severe is it?
Well, the main one is the one that started in 2009, the pandemic H1, the swine flu. But to be honest, here we've been seeing at the hospital both influenza B and the other influenza H3. So it's been quite a mixed year and quite surprising, but certainly the pandemic one is the most common.
And given that more people are affected this year than at the same time last year, should more people this year be thinking about getting vaccinated?
Look, it's always a good idea for someone with a chronic medical condition to get vaccinated, whether they're a child, an adult or an elderly person. You can get that done by your GP free of charge. The vaccine's free, and we recommend that for people at high risk.
There were worries about the vaccine last year, cases of children fitting after having been vaccinated. Are those worries still around?
Yeah, people are still concerned about that, and what they need to understand is the vaccine which caused that was just one vaccine, and we're not using that in children this year. The vaccines we're using in children this year have been shown to be safe, not only in Australia and New Zealand, but also in the Northern Hemisphere.
What about these severe cases of flu or strains of flu that crop up from time to time? Bird flu, I think, was the last one. Are those worries still around?
Well, bird flu is on the outer, because it just doesn't transmit very easily between humans. But to be honest, it's still happening in places like Indonesia, Cambodia, Egypt, so we're keeping an eye on it, but it's not a problem.
Professor Robert Booy, thank you.
You're very welcome.